We're all very human and fallible, and yet we live in a society that rewards pretending we're not fallible, or the range of acceptable fallibility is narrow.
We are constantly comparing our insides to other people's outsides and feeling inadequate and guilty, even ashamed.
Trying to blend in means parts of ourselves must disappear, and we must then live in fear that we will be found out.
Here, together, we will create a space where we can laugh, cry, and carry our suffering and hurts lightly.
In the service of being deeply human.
This is Life's Dirty Little Secrets.
Welcome to Life's Dirty Little Secrets. I'm Emma Waddington.
And I'm Chris McCurry. And today it is our great privilege and honor to have Dr. Howard Schubiner here with us today. He's a clinical professor at Michigan State University College of Human Medicine and is a fellow in the American College of Physicians and the American Academy of Pediatrics. He's authored more than 100 publications in scientific journals and books and lectures regionally, nationally, and internationally, and has consulted for the American Medical Association, the National Institute on Drug Abuse, and the National Institute on Mental Health. His clinical practice is CormidyHealth.com, and he has a website, Mind Body Medicine for the 21st Century, several books. All of this will be in the show notes, and he will mention his newest book that will be coming out shortly at some point here today. So without further ado, welcome, Dr. Schubiner.
Yeah, thanks for having me on the secrets, the Dirty Little Secrets show.
Dirty Little Secrets.
That's exciting. I haven't been on a Dirty Little Secrets show before.
Well, we try to make the most of it. The secretier, the better. So your life's work has largely been around pain, chronic pain, other kinds of pain, but you've also written about anxiety and depression and other sorts of conditions and situations that plague a lot of people in our society. And you've got some very interesting and powerful ideas and strategies for dealing with these situations. So I'm just going to let you jump in at where you think our listeners would best be informed in terms of being introduced to the topic and your work.
Yeah, thanks so much. I mean, there's diseases, as a physician, I know there's diseases that cause mortality, cancer, stroke, heart attack, dementia, and cancer, of course. And these disorders have clear pathology in the body. They kill people. They occur equally in men and women. They're pretty stable in society. Medical treatment has advanced. There's decent medical treatment for a lot of these disorders, and they occur much higher. The older you get, the more likely you are to get one of these diseases. Now, the problems that I deal with are the morbidity conditions, the ones that don't kill you, the ones that are rising dramatically in society, all of them, that occur more in women than men, that occur in younger people, not in older people, and that don't kill you, but they cause tremendous suffering. And modern medical treatment for them is generally not that great. And this is a huge chasm, a huge divide, and people have been unable to explain that, unable to explain any of those things. Why are they rising? Why are they in young people? Why are they more in women? Why? And we can't find clear pathology or medical evidence of disease in the body for all of these conditions: chronic headaches, migraine, chronic back pain, chronic abdominal pain, irritable bowel syndrome, chronic pelvic pain syndromes, widespread pain, fibromyalgia, chronic fatigue syndromes, anxiety, depression. All these go together, and many of the people who have one of these have many of them. They flock together. There's something that they all have in common. And that's the secret.
All right.
Right there. That's it. That's the question. Why?
Yes, exactly. And so what have you and others found? What is the common denominator in all these things?
The common denominator is that we now understand the neuroscience of how the brain works, that doctors don't know, that I wasn't taught in medical school. And the neuroscience of how the brain works is called predictive processing, which sounds like a woo-woo concept because it posits that the brain creates what we experience. So that sounds like, okay, give me a break. It's like, yeah, oh yeah, I want to be a millionaire. My brain will create wealth, right? There's been that kind of positive thinking out there, but our brain creates what we see. We don't see with our eyes. You can see in your sleep, in your dreams. Our brain creates what we hear. We mishear things all the time. Our brain fills in the gaps. And when you touch a hot stove, it's not your finger causing pain. It's actually the brain. And this is a very difficult concept for people to grasp. But we know it's true because thousands of people have had injuries, like a guy shot a nail in his hand and had no pain. Everyone knows people have had injuries and had no pain. If you have an injury and you have no pain, what does that mean? It means the brain is in control of whether you have pain or not. The brain is in control of whether you have fatigue, anxiety, or depression or not. And the brain can be triggered to produce these sensations with physical injury, with medical disease. Of course it can. But secret number 2, the brain can also produce these syndromes, these sensations, these symptoms, pain, anxiety, fatigue, depression, in the absence of physical injury. Secret 3, most people who have chronic pain, chronic anxiety, chronic depression, chronic fatigue do not have a physical injury in their body to account for their symptoms. Okay, I just said 3 things that are so counterintuitive, so different than what most people think and what most doctors think. But we know it's true because of the neuroscience, because of our clinical experience, and because of our research. Emma, have you had an experience with this?
Hello, listeners. I'm Emma,
And I'm Chris.
and we are so excited to share with you our latest workbook, Just in Case Sits with Anxiety, which was published by Jessica Kingsley. The workbook takes us on a journey with Justin, who's about to have his very first babysitting job. He is excited, but quickly gets hit with a wave of what ifs. What if something goes wrong? Or what if he's not good enough? In the workbook, Justin overcomes the inevitable challenges of babysitting 2 toddlers whilst learning ideas and tools to help him understand his feelings and face those fears, whilst learning to do what's most important to him, being a kind and resourceful kid. Based on acceptance and commitment therapy, it's packed with activities for kids plus helpful tips for parents. Order now on Amazon to find out how Justin learns to tackle his worries and move forward with courage.
Wow. I feel like we have to sort of take each one of those and think of examples. I mean, that's phenomenal. I think for me, thinking that the brain creates pain isn't what we're taught. Like you said, you're talking about medical school, but I'm thinking even in just common parlance, right? We don't talk about that. We talk about, you touch the stove, like you said in the example, and the pain is felt in the finger where it is that you touched it. The fact that it's the brain that creates that pain.
Yeah.
Is crazy.
So research shows, here's the 4th secret. Research shows that stress and emotional injury activates the same parts of the brain as does a physical injury. So now we have a reason. Now we can begin to understand that our brain has a danger alarm mechanism like a smoke alarm. If someone has an emotional injury, this relates to all sorts of emotional injuries from childhood traumatic experiences, later life traumatic experiences, children who are problematic, parents who are problematic, bosses who are problematic, neighbors, society that's problematic, injustice. All those things feed into our brain. And when the brain feels endangered, it sends a warning signal. And the warning signal is not in language. It's not in English. The warning signal is in sensations. And so when someone is starting to feel overwhelmed, even if they don't recognize they're feeling overwhelmed consciously, Their subconscious brain is there to protect them and send them a message, and it may give them some anxiety. They may have trouble falling asleep at night. I saw a woman who was having trouble falling asleep at night, and a young woman, and she goes to the doctor, and they say, oh, you need some, sleep medicine. You have trouble falling asleep. Well, it turned out she had a date rape a month before that. And she didn't have any idea that was connected to her lying in bed, not being able to fall asleep with her heart racing. But likely that's what it was. And the brain can produce headache pain. If you're under a lot of pressure, all of a sudden your head feels pressure. Maybe, someone's a pain in your neck and you have neck pain. The brain creates these experiences as guides, as messages, as protectors. And it's just true. That's what it does. When I started my internship, I was a scared young physician, scared of making mistakes, scared of hurting people, not knowing what I was doing in a city hospital where I had way too much responsibility. And every morning I had diarrhea out of the blue. I'd never had it before in my life. What was going on? I was scared shitless, right? So that's what our brain does. And when we fail to recognize that, what happens is the next secret is that you go to a doctor with your symptoms, your back pain, your headache pain, your stomach pain, your fatigue, and the doctor's running all sorts of tests and maybe finding things, maybe not finding things, but treating everything as a physical ailment. And if it is a physical ailment, great, you need medical treatment. But most of the time, it isn't. And we have a back pain study we did. We evaluated 222 people with chronic neck and back pain. And when you use our criteria, careful, detailed history to determine is it really a structural problem or not, we found that 88% of them did not have a structural problem to account for their chronic back pain. But when you treat it as a medical problem, you can actually make it worse, because you're doing procedures, you're doing injections, you're giving medications, and you're scaring people thinking that there's something wrong and that they're never going to get better. The message the medical profession gives to people with chronic pain, chronic anxiety, chronic depression, chronic fatigue is you're never going to get better, which actually makes it worse.
Can I ask about the structural damage piece? Because that's pretty key, right? That's kind of step one in this journey, is to understand that the source of your pain isn't structural. And that is a huge shift for many people. So if we think of people who've had chronic pain for decades and they've gone down the medical route, and, some of them, let's say if we're thinking about pain from, the back, the neck, they'll have had MRIs. And like you talk about, most MRIs will find something. As you get older, the stats are quite staggering, actually. That
40% of people in their 30s who have no back pain at all, 40% of people in their 30s with no pain will have an abnormal MRI.
That's incredible. Yeah.
So 50% of people in their 40s, 60% of people in their 50s have an abnormal MRI, again, with no pain. And then 90% of people in their 60s have an abnormal MRI, bulging disc, degenerative disc, spinal stenosis, facet arthropathy, spondylolisthesis, all these what we call normal abnormalities. And when you have this high rate of those things on MRIs in normal, healthy people, why would we assume that those are actually the cause of pain? We shouldn't assume that. We shouldn't. But we do it every single day.
Yeah.
Which creates more fear, more worry. And it turns out one of the things that causes persistence of chronic pain, chronic anxiety, chronic fatigue, chronic depression, the persistence is caused by two major things. One, ongoing stress and emotional issues, maybe related to early childhood trauma or not, but ongoing. And the second thing is the fear and the worry and the focus on the symptoms themselves. So the message that you're never going to get better creates a powerful effect that sends feedback to the brain, which tells the brain danger, and the brain creates more symptoms, which is a very negative, vicious cycle of pain leading to fear, leading to more pain, or anxiety leading to more fear of the anxiety, leading to more anxiety. and a loop that you feel like you can't get out of. And when medications don't help, and injections don't help, and massage doesn't help, and physical therapy doesn't help, and alternative medicine doesn't help, what are you left with? You feel just so devastated, so demoralized. Your life is broken. You're losing your friends. Your life is caving in on yourself. You can barely get out. And all of these symptoms are real. They're not imaginary. They're not in people's heads. They're not fake. They're not their fault. They're not because they're crazy or defective or weak. Why do women have higher rates of these mind-body conditions? And the best answer that I can come up with after consulting with a lot of women and feminist theorists is that women have higher rates of sexual assault than men. They have higher rates of emotional abuse than men. They have higher rates of conditioning and social conditioning to be good and succeed and don't speak up. They have higher rates of what's called self-silencing. When they are attacked, when they've had sexual assault, they're more likely to keep a secret out of shame, another secret. They're more likely to have sexual harassment in the workplace, discrimination in the workplace, mean girls, bullying, social media issues, single parenting of children, caring of older adults. This is a lot of stuff. And the danger signal is just more likely to be turned on when you're in that kind of situation. Obviously, a lot of men have these conditions as well. But the fact is, women do have higher rates. And I think there's good reason for it. And I think if we recognize that, we begin to see that we actually need some changes in society. It's not women's fault that they have these things. It's how our society is structured.
Yeah, that's quite striking, isn't it? And I'm just wanted to touch back on the structural piece. I know it just feels so important because people get so stuck there. Is there, given that the rates of it being structural, as in when we're thinking about chronic pain, the mind-body syndrome, we're thinking about those people who it's not structural. There are some people that it is structural.
Of course. Of course it is.
A small group.
Of course.
And I guess just being in a place where we can say it's not structural feels quite radical for some people because exactly that. People think it's in your head then, which is not what we're saying here.
99% of the people who have structural pain are going to be found out to have structural pain in an evaluation within a month, within a couple months. It's not hard to do. Doctors know how to do this. They know how to find abscesses, fractures, tumors, cancers. We know how to do that. We know how to find inflammatory conditions. But when those are not found and the pain or the anxiety or depression, et cetera, continues and goes on and on, the chance of it being structural goes lower and lower.
Yes. And that's when it gets chronic and the sort of anxiety. So I thought I would share a bit about my journey, just because I'm hoping it'll be useful to listeners, but also because as a psychologist, at different points through the journey, I was told I should know better because I'm a psychologist. And so I think probably over the span of on and off, probably 20 years, I've had pain. And actually, it's through this work that I came across, thanks to my fabulous physio, I came across your work not that long ago. And it was radical. So I had my first back injury. I was in my early 20s. And as I was researching for our conversation today, I saw the story, the narrative is so aligned with everything we're talking today, more so than I'd realized prior to our conversation. So my first back injury, I was backpacking with my husband, my now husband. We were caught in a cyclone in the middle of Botswana.
I hate when that happens.
Isn't it? So inconvenient.
Getting caught in a cyclone.
And I was terrified. He wasn't. This just shows a difference in perception. He was fine, but I was terrified. And we were in the middle of nowhere and just a handful of people. Anyway, I got quite scared. A few days later, I was doing yoga. And having done yoga for years, I felt my back. And we were sort of traveling in a truck, and I felt my back and I felt uncomfortable, but mostly I was sort of riddled with anxiety, what had happened. We got back to the UK. Well, he continued traveling, but my anxiety took me back to the UK back. I couldn't continue my trip. And my back kind of got progressively worse, as did my anxiety. And eventually I had sort of PTSD from that incident. And I got my treatment. And then I also saw physio, and my back got worse. And then it seemed to get better. And then it seemed to get worse with stress. But at the time, I didn't realize it was stress. And I remember somebody once saying, I wonder if it's the weather, which is something that I hear people say since then. And so that was my early 20s, up and down with stress, preparing for our wedding. My back got worse. And then eventually it seemed to settle. Not really clear why it settled. It just did. It went. And then a few years later, I got pregnant. And then I got pelvic pain during my pregnancy, and it was really bad. It got to the point with my eldest where I was in crutches and even wheelchair. I couldn't walk much at all because of my pelvic pain. And nobody understood it, why it got so severe. And everybody said that postnatally, you'll be fine. As soon as you give birth, you'll be fine. It'll go. And of course, I gave birth, it didn't go. And that created immense anxiety. In fact, I couldn't carry my son for a long time because of this physical pain. It was so scary. Nobody could tell me what was happening. And physios didn't know, doctors didn't understand. I was wearing a brace. Eventually I started running. And running seemed to help. And it makes no sense. I can't carry my baby, but I can run.
Right, right.
And so I got well enough to get pregnant again.
Well,
And
just one thing.
yes,
You think about it, when the brain can turn on neural circuits for pain, and it can turn them off.
right.
And it can turn them on when there's more danger or feeling more stress, or your brain
that's
perceives
right.
danger. Maybe your brain was perceiving danger with the pregnancy for a whole variety of reasons to do with your physicality of being pregnant, but some about having a baby and having a child and all sorts of things that relate to your childhood and what your mom was like, etc. But and running can put the brain into a sense of safety sometimes.
Yes.
Or whenever the brain is in a sense of safety, it will turn off pain. And so when we see this pattern of pain turning on and off,
Yes.
shifting or moving, coming and going, occurring with the weather, being triggered by innocuous things, that's our clue. That's the medical clue. And that's what we did in that research study I was telling you about. That's the clues that we can make so that we can figure out, is the pain, a mind-body type pain or not, or is it structural? So
Yes.
that's a huge clue. And I just really wanted to make sure that
Yes.
point, was clear to people.
Absolutely. And I couldn't make sense of that. I noticed that, and I could not make sense of it. And people couldn't explain it to me. And we fast forward my second pregnancy. I moved to Singapore soon after. And my pain was better. I mean, my second child was 8 weeks old when we moved to Singapore. And I was still on crutches when we moved with a 2-year-old and a 6-week-old or 8-week-old. But my pain seemed to be better until we moved. And of course, it got much worse when I got here. And again, I couldn't make sense of it. Physios didn't know. We tried everything. Nothing was getting better. And eventually I went to a pain specialist who said to me, as a psychologist, don't you think you should be able to handle this better? Which added immense shame to the whole.
Do you see what happens to women?
Yeah.
This is a perfect example of how women are dismissed, gaslit, mistreated, ignored, not heard, not seen. I mean, it's a perfect example of that. I hate to say it.
It was horrible. It was horrible.
I was just going to say, for the men, they probably wouldn't even go to the doctor. They would probably just try to suck it up and be like manly about it or something. So it's not like the guys are getting off easy here. Oh, or
Yeah.
we wouldn't be dying how many years younger than typically for females? But anyway,
Yeah,
just
we're
thought I'd
better at health
throw that
seeking.
in there.
Yes. Just the final bit, because that's where it all sort of gets better, thankfully. It took me a while, but I started to work with a physio, and I noticed that one of my biggest fears, which is so bizarre, was stepping over things. So I had this pelvic pain, and stepping over things used to really trigger my pain. And then in a therapy session with my physio, I said to him, even if I think of an iPad on the floor, a toy on the floor, I get pain. And that's when he started to tell me about this work, because it was insane. I could stand there, have no pain, and I could close my eyes and go, I imagine a toy, and I could feel the anxiety and I could feel the pain, because the thought of lifting my leg, because my pain was in my pelvis, terrified me. And I felt I was in prison. During this period in my life, I very much felt like I was in a prison with this pain, trapped. Nobody could tell me exactly what it was. They told me at best I could get 50% better. I then went on to have a third child, and she's fabulous. And I was pain free during this pregnancy, having been in a wheelchair in my first. Like, it was crazy. And I ran through my third pregnancy. Running was always my thing.
Well, what you described is what I call provocative testing. And provocative testing is a procedure we use to help demonstrate the neural circuits of the brain. And so we have people close their eyes and imagine a triggering situation for pain or anxiety or fatigue. It might be walking, standing, bending, moving. In your case, it was stepping over something. And often the imagination feels to the brain as if you're actually doing it. And then the brain creates the fear, the anxiety, and the sensations often, not all the time, but most of the time. And then that can become a click moment where you realize. And I think that's what really happened with you in your physio world. You had that moment where it just kind of clicked in. And all of a sudden you realize this is something different. And maybe you realize either consciously or unconsciously that it was your brain. And then that might have propelled you to worry less, to be more active, and to see that when you ran, you were good. And that kind of created a positive spiral toward resolution.
Yeah, it is. It really is. And it still happens. I'll get moments where I'm scared that it's going to come back. And I feel the fear in my body. Like, that's something that I've come to realize, that I feel fear physically, like sensations, like body sensations. I've had, bouts of back pain since then. And it's always been in moments of high stress. Like, there'll be an injury, I said air quotes, as in I might do something during exercise and I'll get an injury, but then it persists because I start to get scared. I'm like, oh no, here we are again. I'm going to be trapped in this for X number of months or years. And you start to think about what you're doing and you restrict your behavior. And then I become very self-conscious, as in I'm monitoring my pain. Does this hurt? Does that hurt? What's going on here? And I get stuck in that fear cycle that you described, where I start to fear the pain. And so I'm monitoring more. And so I'm restricting my exercise. So my emotions, I feel like I get stuck in that prison. And that makes me anxious and worried, which triggers the pain. Just heartbreaking, but so real.
That feeling of trapped or being imprisoned, does that take you back to something in an earlier time in your life where you felt a similar situation to that?
No.
Frequently, that may or may not resonate for you, but frequently that happens. Emotions are physical events. Emotions are felt in the body. And it can be felt as a tightening, electrical, a numbness, a tingling, a heaviness, fatigue, And we in our society, tend to teach people to hold their emotions down and in, to not speak them, to suppress them, to not get angry, to not express themselves. We teach boys, it's not good to cry, you should hold your emotions in. We teach girls, you shouldn't get angry, which it's not nice. We teach people to be people pleasers, always put everyone else first. And, those kind of things can build up over time. And sometimes you get in a situation where it just hits a breaking point, and that's when that danger signal goes off. And it can feel like you injured yourself, because, oh, I was doing yoga, but maybe you didn't really injure yourself. You were just doing yoga.
Yeah. Yeah. And it was a sensation. I think that's pretty crazy.
Yeah.
As in to think that emotions cause physical sensations. I don't think I until I've experienced it myself, I didn't really believe it. Like I thought it was independent. Physical sensations, physical pain is one thing. Emotions is a different thing. But now I see how emotions can feel like physical pain might be. Okay. Like I notice it. Like one of the things that helped me with my pain, and I remember my pain specialist gave me, were muscle relaxants. And I remember thinking, I was like, give me whatever you've got, all of it. I'll take whatever you have. and he gave me muscle relaxants. I thought, why are you giving me muscle relaxants? It worked a dream.
Yeah. Yeah, those
Why?
actually work on the brain.
Exactly. And I was so calm and doing so well. But they're not, they're dealing with that exactly on that neurological level. They're calming my nervous system down because that's what needed to quieten.
Exactly. Yeah, it's so counterintuitive. The situations seem out of this world, like couldn't possibly be true. And most of the people who work in this field because they've had their own personal experience with having pain, anxiety, depression, or fatigue that they couldn't figure out. And they finally figured it out because they found this mind-body connection, and they found the role of emotions, and they found the role of stress and fear and feeling trapped. And then they got better, and then they're like, oh my God, I've got to tell other people about this. I've got to try to help other people. And so they become a therapist, they make a movie, they write a book, they become a coach, they do all sorts of things because they really want to help others to see this. And the people who've never experienced this find it very hard to believe. And what's really hard to believe is how frequently, not all the time, but how frequently the solution to these chronic mind-body type symptoms is relatively simple, is relatively straightforward, because you don't have to fix the body because the body's not broken. So that takes the load off. You can learn that it is the brain, which takes another load off. You can have hope and optimism that you're going to get better, which takes another load off. And all of a sudden, you're taking these loads of worry off of the brain, and you start to treat the sensations that you have with curiosity rather than fear. You start to notice when they go up and down. You start to notice that they're related to stress. Maybe you start to deal with some of the emotional situations in your life. And all of a sudden, your brain goes, okay, never mind. We're okay. We're good. And the symptoms turn off. And maybe they only turn off for a day. But then when they turn off for a day, you really realize, oh my goodness, look at that. It just went away. And then you have more understanding and more hope. And then it turns off for a couple days. I saw a guy yesterday. Okay. He started getting headache and neck pain when he was 8 years old. He's 73 now. So 61 years of pain. And it started when he was a boy in school. He was reading a book, an unauthorized book in class. The teacher came up behind him, whacked him in the neck, scared the crap out of him, whacked him in the neck, and he's had headache and neck pain for 61 years. He was also being bullied at school, bullied by a father, bullied by a brother. There's a lot of stuff going on in his life at the time as well. He's had a long and successful career. And when I saw him yesterday, the first thing he said to me is, I have been headache-free for the last 10 days. It's the first time I've been headache-free in 61 years because he was started doing this work after all those years. And he was so happy, so happy.
So, what does the work entail? I know you've got brain
Oh, you want to know
reprocessing
that?
therapy. Well, I'm sure our listeners at this point are saying so. What
No,
do I
that's a
do?
secret. I can't tell you.
Okay, well, I guess we're just going to have to buy your books.
No. So there's 5 parts to the model. 1, making the assessment, making sure there's not a structural problem. Number 2, educating about the brain, explaining predictive processing, how the brain creates what we experience, helping people see that's what they have and that there's a a path for recovery, not just living with and coping with your symptoms, but recovery. So then we have 3 types of treatment. One is called pain reprocessing therapy. The second one is called emotional awareness and expression therapy. And the third one has to do with changing your life and changing how you treat yourself and others. The first one, pain reprocessing therapy, is called, I call it a fear reappraisal therapy. So what you're doing is instead of fearing the symptoms, focusing on them, fighting them, being frustrated with them, trying to fix them, trying to figure them out, what you're doing is you're just noticing them. You're stepping back. You're observing them. You're watching them. You're letting them be. You're telling yourself you're okay. You're starting to move with less fear. You're running or you're walking or you're doing yoga, doing something you love without fearing the sensations, and that helps to turn off the danger signal in the brain. The emotional awareness and expression therapy has to do with dealing with emotions. And so that has to do with recognizing when emotions come up. Oh, I started to get this pain in my neck. What's going on? Let me think. Oh my goodness. Someone was treating me poorly. I don't like it. Oh my goodness. I'm actually resentful. I'm actually angry. I'm going to allow myself to be angry. And I'm going to go in my car and I'm going to cuss them out for a minute. And I'm going to go, wow, that felt good. And then I'm going to let it go. And maybe I'm sad. Maybe I'll need to allow myself a little tear. Maybe I need to give myself permission to cry. So you're allowing these emotions to come up in safe and healthy ways. You can also use this therapy to go back to heal childhood hurts and childhood trauma. And the final part of it has to do with the way that we've adapted. So the people pleasing, the perfectionism, the self-criticism that people have. People often need to change how they treat themselves. People often need to be kinder and more caring to themselves. People often need to have compassion for themselves. People sometimes need to take a stand in their lives. Sometimes they need to speak their mind. I had a man who had headaches for 12 years, very severe headaches, really disabling. And one of the things he had never done, he had never spoken honestly to his wife about things that had bothered him. And he had never, I can't do that. I can't, it wasn't even part of what he even thought was possible. And when I helped him to figure out ways to speak to her with civility and honesty and authenticity and with love and caring, their communication improved. And she could see what he needed and he could see what she needed. And he was like, that's amazing. And his headaches went away. Some people need to change their job, Some people need to get divorced, I mean, I had a woman who was in an abusive marriage and she was having a lot of pain, one of which was migraine. And when she finally decided to leave, she drove her car out of the town she lived in. And on the way out of the town, as she drove away, that was the last migraine she had. It was amazing. So those are the 3 areas of therapy that we use. And, they're inexpensive. They're relatively simple. It's amazing.
I mean, it sounds very much like the therapy that Emma and I were trained in, acceptance and commitment therapy, which has a lot of that mindful noticing with curiosity,
Yeah,
allowing, that's the acceptance part.
exactly.
And then, orienting toward having the best life that you can, even
Exactly.
if from time to time these thoughts and feelings show up.
Acceptance and commitment therapy is a great therapy. It has not been shown to be particularly effective for chronic pain for 3 reasons. One, people do it in the absence of doing that structural evaluation. So people are using it for pain that they think is structural, because what else are they going to think? They've never had that evaluation. Number 2, ACT is geared toward helping people cope with pain better. And it's good at that, but what people don't want just to cope with pain, our work is geared toward reversing pain. So it's the techniques are quite similar, but the intent and the direction is toward reversal rather than coping. And the third thing is our method also has a heavy emphasis on the emotional part, which ACT has less of. And, one of our research, in our PRT research studies, 2/3 to 3/4 of patients have been pain-free or virtually pain-free within a month or two. That's phenomenal for chronic back pain. And in our EAET studies, which we've compared in several of the studies, EAT to cognitive behavioral therapy. Cognitive behavioral therapy is a great therapy, but it also is a coping therapy. It has very small effects on pain itself, on pain reduction. It has the same effects on pain reduction as ACT and as mindfulness-based therapies. In our studies that Brandon Yarnes did out at UCLA with veterans, older male veterans with chronic pain, average duration of pain 26 years, very difficult to treat in that sense. EAT was way superior to CBT in these studies. Amazing. And I can send you all those studies.
EAT is the emotional awareness therapy. Wow.
Exactly.
Incredible.
And so what we do clinically, we combine the pain reprocessing, the fear reappraisal part, with the EAT, the emotional awareness and expression part, with the making changes in your life. So we do it all. Instead of in the research studies, it's just studying one, because research has to be more like boxed in, do this, manualized.
So in the interest of time, what should we leave our listeners with?
The main things from my point of view are the symptoms are real. They're not in people's heads. They're not because they're crazy or defective. It's because of being human. Everyone gets mind-body conditions. It's part of being human. And the fact that women have higher rates is because women have harder lives. It's just a fact in general. Number one. Number two, don't give up hope. There is hope for these chronic conditions. Please keep an open mind. Look at our literature, look at the books. It's not just my books. There's a lot of people in our community who've written books. There's the tmswiki.org, a free peer-run website. There's the ATNS symptomatic.me is a nonprofit organization that we founded that has tons of information, has courses on it. We teach a lot of courses on my website, unlearnyourpain.com. There's a list of all the courses that we teach. I have a course on Coursera that's free, coursera.org/learn/reign of pain, REIGN, reign of pain. And that's a free course that has all this information on it. There's hope. And the most important thing that people can do is realize that they're worthy, they're deserving, they're worthy of getting better. They don't deserve to be with these chronic symptoms. And the compassion that they can take for themselves can lead to action that can have hope for recovery.
Wonderful. Thank you so much. This has been amazing, and I know it's going to be very helpful and inspiring and hopeful for listeners.
Yes, thank you. And I've personally benefited from your work and feel immensely grateful that there is a way out of pain.
It's amazing. Yeah, I'm collecting names of people who want to stand up and add their name to a list that I'm going to be publishing in my next book, and we'll send you that link. If anybody wants to add their name to the list, we would welcome it, because it's a worldwide list, and it's really amazing to see people all over the world, doing this work. It makes you feel like you're not alone.
That'll be in the show notes.
Thank you. Thank you.
All
This
right.
has been amazing. Incredible. It's
Thank-
taken us a while, which is just a sign of how important this conversation needed to be.
Thanks so much, guys. I appreciate it
Thank you.
greatly.
Thanks so much for tuning into the Life's Dirty Little Secrets podcast.
If you have any feedback for us or secrets for future episodes, you can email us at lifesdirtylittlesecretspodcast@gmail.com.
Be sure to follow us on Instagram at Life's Dirty Little Secrets or on Facebook at Life's Dirty Little Secrets Podcast.
We invite you to follow, rate, and review us on wherever you listen to this podcast. It is the best way to get our podcast out in front of new listeners.
We'll be back in a couple of weeks with more.
See you then.